In this session, we'll understand about health, disease according to yoga, and the role of stress in disease, and finally, the concept of panch. Now that we've explored the concept of Ashtanga Yoga for holistic health, let's examine how neglecting these practices in your daily life can result in significant stress, ultimately leading to various health issues. For that, let's understand health first. The Sanskrit word for health is very apt. It defines good health in just one word, swastha. This word is made up of swa, meaning the self, and stha, meaning to be established in. So, one whose consciousness is established in the self is the possessor of good health. In order to peacefully establish awareness in one's inner core or center, there should be no disturbances in the bodily functions, mental faculties, emotions, or interactions with the external world, and there should be perfect contentment with one's life situation. This short definition of health fulfills all the criteria of the modern definition of good health given by World Health Organization, which describes health as good health is a sense of well-being at physical, psychological, emotional, social, and spiritual levels. The yogic view is exactly the same. In yoga, good health means harmony in all the 5 koshas or sheaths or layers of the bodies. Annamaya kosh, which is the physical body, pranamaya kosh, the energy body, manomaya kosh, mental body, Vijnanmaya kosh, the wisdom body, and Anandamaya kosh, the bliss body. We will discuss this concept later in detail. Ayurveda, the Vedic science of health, considers health to be a state where all 3 doshas or biological humors of the body, that is, Vata, wind or gas, Pitta, bile, and Kapha, mucus, are well balanced in harmony. Sushrut Samhita defines a swastha, a person in good health, as one whose doshas, somatic and psychic humors are in a state of equilibrium. The digestive capacity is uniformly balanced, the fundamental tissues of the body and waste excretion are functioning normally, and the soul, cognitive organs and mind are in a lucid state. Health depends upon the way we live our life. If we do not take the rudder of the boat of our lives in our hands consciously, the boat will sail in any direction, inviting various diseases. The science of yoga is about re-establishing the dormant link between the individual and the inner self. In order to establish this link, the bodily functions, mental faculties, emotions, and social interactions need to be balanced through yogic practices. And the key is a feeling of contentment and inner joy. This restores the balance. The positive energy of this state rushes to the area where there is a weakness, whether it be an organ, the mind, or the emotions, and mends it. Medical science now accepts that there are different stages of disturbances or imbalances before the state of health changes into a manifest disease. It is much easier to stay healthy than to change the state of disease into good health. The quality of life, whether in health or in sickness, is completely in our own hands. So, wherever one is stationed, there the journey begins. Once the journey begins, it definitely takes us towards the destination. So, we'll understand what is disease according to yoga, how yoga describes disease. The absence of good health is ill health. Disease, that is, this plus ease, is a state of ill health where the symptoms start manifesting at the level of the body and or mind. The state of disease itself can be classified into 4 stages. In the first or psychological stage, the symptoms are only at the level of the mind. The second stage is psychosomatic, where mental symptoms percolate into the body occasionally. In the third or somatic stage, the physical symptoms outweigh the mental symptoms, but the disturbance in the body is still reversible. In the final organic stage, there are irreversible structural changes in the body, making the disease a permanent guest. However, on the other hand, yoga defines disease as an imbalance or disturbance within any of the 5 dimensions as mentioned, that is, Annamaya Kosh, pranamaya Kosh, manomaya Kosh, Vigyanmaya Kosh, and Anandamaya Kosh. This imbalance can originate in any kosha or sheath and, if not addressed then and there, can percolate to other dimensions progressively. For instance, an issue in the physical body might stem from or lead to disturbances in the mental or emotional bodies. In addition to this, stress plays a significant role in the development and progression of disease. Stress is a ubiquitous aspect of modern life, often perceived as a mere response to challenges or pressures. However, its implications extend far beyond everyday discomfort, significantly impacting both physical and mental health. Understanding the relationship between stress and disease is crucial, as chronic stress can exacerbate a range of health conditions, from cardiovascular diseases to autoimmune disorders. This exploration delves into the physiological mechanisms through which stress influences health, highlighting the importance of recognizing stress not only as a physiological phenomenon, but also as a critical factor in disease development and progression. Usually, stress arises when a situation demands more from an individual than they can readily provide, impacting the body, mind, and consciousness. If our recuperative abilities can counteract the stress and restore balance, it results in eustress, which can be beneficial for us. However, when stress overwhelms our capacity to recover, it leads to distress, causing harm both in the short and long term. Distress can affect any of the koshas or sheaths of our existence, potentially leading to severe conditions like cancer as well. Research indicates that chronic stress affects genetic behavior and can contribute to mutations and diseases. Studies have shown that stress impacts the immune system and can influence the progression of cancer. For example, stress can slow healing process, impair immune responses, and potentially increase cancer risk as well. So, what should be the human response to stress? Stress impacts humans similarly to other living beings, but is compounded by our unique ability to repair, regenerate, and adapt. Stress can be categorized into various types such as dietary or nutritional stress, occupational stress, interpersonal stress, mental stress, disease-related stress, and environmental-related stress, etc. These stressors can cumulatively weaken an individual's ability to cope with and overcome disease. Stress initiates neurohormonal changes affecting behavior and bodily functions. Both external and internal stressors trigger similar responses in the body and mind, involving neurotransmitters that coordinate the body's reaction to maintain internal balance. Stress initially activates the immune system to combat perceived threats, but can weaken it over time with prolonged exposure. Stress increases sympathetic nervous system activity, affecting the whole body. Chronic stress leads to hyperarousal in neural pathways, raising blood glucose levels. And stress results in the release of hormones that increase blood glucose and metabolic rate, affecting cell repair and regeneration. So, it is important to mention the body-mind system learns from stressful events, creating memories that influence future responses. Repeated stress can condition the body-mind to respond automatically, even when such responses are no longer appropriate. In summary, we can say that understanding stress and its impact on the body is crucial for managing health and preventing disease. In such a case, yoga offers practices to address these imbalances and enhance overall well-being, highlighting the interconnectedness of physical, mental, and emotional health. Alongside our discussions on health, disease, and stress, to achieve a more holistic understanding of health, let's delve deeper into the concept of panch kosha, which encompasses the 5 dimensions of our being that significantly influence our quality of life. To effectively address a disease, it is important to understand the yogic perspective on a healthy body, particularly through the framework of panch kosha. This concept outlines 5 layers of human existence: the physical body, the vital energy body, the mental body, the emotional body, and at last, the bliss body. Each of these layers interacts and influences the others, providing a holistic view of health. Without a deeper understanding of this yogic framework, we may miss crucial aspects that contribute to an individual's well-being. Recognizing how imbalances in one kosh can affect the others is vital for developing effective solutions. For instance, addressing physical symptoms alone may not suffice if underlying emotional or spiritual issues are overlooked. By integrating the principles of Panchkosh into our approach, we can create more comprehensive and tailored solutions that promote overall health and healing. This holistic understanding empowers practitioners to support individuals on multiple levels, fostering a more complete recovery process. Additionally, studying the concept of Panchkosh in relation to palliative care is important for various reasons, such as holistic approach, as Panchkosh, which refers to the 5 layers of human existence, provides a comprehensive framework for understanding the multifaceted nature of health and well-being. In palliative care, this holistic perspective is crucial as it addresses not only the physical symptoms of a disease, but also the emotional, psychological, and spiritual needs of patients. Understanding the concept of Panchkosha also helps in personalizing the care for the subjects. By recognizing the interconnectedness of the 5 koshas, healthcare providers can tailor interventions that resonate with the individual's unique experiences and needs. This can enhance the effectiveness of palliative care by focusing on improving the quality of life and providing comfort in a more rounded manner. We also get to understand that the emotional and spiritual support for the subject is really important, as palliative care often involves navigating complex emotional and spiritual issues, especially as subjects face life-limiting illnesses. The Kosha framework encourages practitioners to consider these dimensions, fostering deeper conversations and interventions that can lead to greater peace and acceptance for patients and their families. It also helps reducing the stress and promoting general well-being, as understanding the koshas also guides stress management techniques that support emotional and general practices such as meditation, breathing techniques, yoga nidra, which is integral to yoga, can help alleviate anxiety and improve the overall experience of the care. The integration of Panchkosh principles into palliative care can enhance the use of complementary therapies, creating a more holistic treatment plan that aligns with patients' values and preferences. So, to conclude, linking panch kosh with palliative care promotes a more comprehensive approach to healing that respects and addresses the entirety of a person's experience. This synergy can lead to improved patient outcomes, greater satisfaction, and a more compassionate care environment. The panch koshas are not simply a theoretical concept but a practical tool for self-discovery and transformation. By understanding these different layers of our existence, we can better navigate our life experiences, cultivate holistic well-being, and ultimately unlock the doorway to our deepest self, the self that is an eternal source of bliss and tranquility. Kosha, a Sanskrit term meaning envelope or sheath, when combined with pancha, which is 5, gives us panchakosh, the 5 layers or 5 sheaths. This concept takes us on a journey through the continuum of our being, from the tangible layers of our physical body to the intangible depths of our unconscious mind, sparking a sense of wonder and curiosity. Let's understand the first kosha, the first dimension of our existence, which is known as Annamaya kosh, the food sheath. The body's outermost layer related to food is the Annamaya kosh. We can see and touch it. The 5 elements, earth, water, fire, air, and space, form this outermost kosha or layer. The food we digest forms the Annamaya kosh, which is why it is called the food sheath. Once we die, this layer returns to its original form of food or other plants and animals. This is the most primitive form of all the layers or sheath, and the pleasures the human body gains at this layer last only a short while. Yogasanas have many health benefits and help maintain optimal physical function. A yoga practice helps treat problems arising in the body, such as chronic lower back pain, upper back pain, or injuries. Regular yoga also increases strength and flexibility, improves breathing, increases energy, balances metabolism, and promotes heart health and weight loss. Generally, people who adopt a yoga practice report feeling more in touch with their bodies. Yoga poses help maintain the balance of the Annamaya kosha since they leave a practitioner feeling physically grounded. Try a mountain pose or Tadasana variation to connect with your physical body, a foundation for many other yoga poses. The next sheath is the pranamaya sheath or the sheath of vital life force. Ordinarily, mortals cannot see the vital sheath as it's much finer compared to the more basic food sheath. It's the pranamaya kosh and the annamaya kosh through which humans express themselves. Therefore, pranamaya kosh is the breath and the life that comes with breathing. The pranamaya kosh separates our beings alive and dead. While prana brings us life, its absence indicates life ending or death. Since the pranamaya kosh is closely tied to life and death, its link with the annamaya kosh is also profound. The annamaya kosh falls apart when prana departs from the body or once we die. The 5 pranas are pran, udan, vyan, saman, and apan form this pranamaya kosh or the layer of vitality. These also create 5 organs through which we perform action, the karmendriyas, or the mouth, hands, feet, rectum, and genitals. We nurture the pranamaya kosh by offering it nutritious food and the other essentials of life, like breath and sunlight. Performing pranayam helps yogis move out of the confines of this layer or kosha. In yoga and meditation, pranayam practice directs the breath and is advised to address the pranamaya kosh. To bring this sheath into balance, try a 3-part breath or dirgha pranayama, a pranayama routine to practice. Now we'll understand the third layer of Panch Kosh, which is Manomaya Kosh. Manomaya Kosh, which is also known as the mental sheath, forms the third layer. Apart from the mind, the subconscious mind and 5 organs help gain knowledge that forms this kosh or sheath. These 5 organs, referred to as the Gyan Indriyas, are the organs that helps us feel sensations. These essential organs are the eyes, skin, nose, tongue and ears. Our mind receive information through these 5 sense organs, and these very organs are behind us, feeling our desires. The Manomaya Kosh is formed by our thoughts, emotions, imaginations, feelings and memories embedded in our subconscious mind. If we fail to control our minds, we may take noxious action that harms our well-being. To strengthen ourselves, we must practice selfless service or karma yoga. Or you can try a simple mindfulness meditation exercise to connect with your Manomaya Kosh and observe your emotions and thoughts. Mindfulness teaches us to recognize our thoughts by paying attention to the present moment. Fourth sheath is the intellectual sheath, which is also known as Vijnanamaya Kosh. This sheath is also known as the knowledge sheath or the sheath of wisdom. This layer of wisdom gives us good sense and separates humans from animals. Both humans and animals are bestowed with emotions, feelings, memories and thoughts, but only humans can tell right from wrong. The Vijnanamaya Kosh also includes our egos, making us conscious of our identities and self-centered. We can strengthen this layer through the pursuit of knowledge. We must understand ourselves through meditation and by studying spiritual texts and scriptures. Meditation is the key to reaching this deeper layer. Accessing the Vijnanamaya Kosh, a meditation that opens the third eye or the Agna Chakra, brings you closer to your innate wisdom and intuition. The last sheath or kosha is the Anandamaya Kosha. This is the outermost layer of our existence. Anandamaya Kosh is the most refined layer out of the all other layers. It bears the vasanas or the desires our personalities nurture and manifests what our souls have experienced through the multiple rebirths. It's through Anandamaya Kosh that we connect with the eternal power. We remain trapped in the rebirth cycle till we successfully transcend this layer. Once we have attained that, we reach self-realization or the state of samadhi, which is the ultimate goal of yoga. What lies beyond these 5 layers is our Atma or the self. While the Anandamaya Kosh brings you close to the Atma or the soul, the Atma remains outside the 5 layers of the Koshas. The blissful self reminds us that our life is still good even when there are things that are difficult, and that being alive is a gift. Yoga considers that we all are born blissful beings and preserve the capacity to be blissful even in adulthood. This means that the Anandamaya Kosh is always available to you and is reachable through consistent practice of yoga, where a deep state of meditation is reached. Connection to the blissful body can be experienced in practices where prayer and mantras are invoked. So with that, we've completed understanding the concept of Panch Kosha. Here's a review. The first kosh is the Annamaya Kosh, the physical sheath, which is the outermost tangible layer composed of the 5 elements: earth, water, fire, air and space. It is the most gross of the 5 sheaths and is primarily addressed through physical practices like asanas. The next sheath is pranamaya kosh or the vital sheath. This sheath is finer than the physical body and is associated with life force energy. It supports and energizes all other sheaths, making its presence essential for their functioning. The third kosh is manomaya kosh or the mental sheath. This layer encompasses the mind, including thoughts, emotions and memories. It plays a crucial role in processing information and making decisions. Fourth kosh is Vigyanmaya kosh or the wisdom sheath. This sheath holds accumulated knowledge and past experiences, including karmas from previous lives. It governs discernment, intellect, and ego, distinguishing humans from animals. The last kosh is the Anandamaya kosh or the bliss sheath. This is the most subtle sheath. It represents our original state of bliss and purity. It remains a passive observer, untouched by the fluctuations of the other sheath. While we are familiar with the Annamaya kosha through physical awareness, the deeper layers remain less accessible. Yoga emphasizes awareness as a tool to explore these dimensions. Through practices like asanas, pranayama, and meditation, we sharpen our awareness on bodily sensations, breathing processes, and inner experiences, enhancing our understanding of ourselves and our interactions with the environment. Even those not practicing yoga can gain some insight into their body and mind. But yoga practices offer a profound means to shape personality and improve quality of life by cultivating a deeper awareness and balanced perception. Thank you.